If you had asked me in 2016 what my nursing career would look like, I never would have imagined where it would take me. Toward the end of 2019, something began changing. By March of 2020, I was a full-blown COVID crisis hotspot nurse. Don't worry, because your girl kept a journal and took photos throughout it all. So this is my story and my recollection of events. Guys, buckle up, because this is part 1 of 5, and here we go.
Emma's laughing at the ducks in a row. Molly's chasing chickens through the muddy grove. Lucy's got flour on her freckled nose. We're a long way from where that old highway goes. Horseradish and honey on a chip plate, spicy sweet just like the life we made.
The American Association of Critical Care Nurses, AACN. Teresa M. Davis was honored to join a March 18, 2020 meeting of the White House Coronavirus Task Force. That meeting included President Trump and Vice President Pence. A significant number of Americans infected with the novel coronavirus will experience life-threatening respiratory distress. Many will require mechanical ventilation to keep them breathing, emergency medications, and equipment to support cardiovascular function while they fight the virus. In the absence of adequate access to ventilators and other life-saving equipment, patients who could be saved will die. Our members are telling us that they do not have adequate supplies. This puts them and their colleagues in danger of contracting coronavirus as they provide life-saving treatment to patients with COVID-19. Your position in government is the result of your hard work and dedication to our country. Now is the moment when you can use that position to change the course of this crisis, to protect your constituents and mitigate the toll of this pandemic. Without your support and aggressive action, our country faces devastating loss of lives. I graduated nursing school in Oklahoma and started my career in the intensive care unit. I was lucky enough to land an externship my last semester as a nursing student and was hired on to a small 7-bed ICU. Shout out to Stillwater Medical Center. Go Pokes! As a brand new ICU nurse, I was fascinated by critical care. I loved the complexity of the teamwork and the privilege of caring for people during some of the hardest moments of their lives. What you're looking at here in this journal entry is the sheer number of COVID patients doubling, tripling, quadrupling in just days. A few years later, life took me to North Carolina, where I joined Duke University Hospital. This was a teaching hospital, and I learned so much here. I continued building my critical care experience, learning from incredible physicians, nurses, respiratory therapists, and so many others who shaped the nurse I would become. This is where my foundation is from. This brings us to the beginning of 2020. Patients were showing up with a mysterious respiratory illness. At first, no one really knew what it was. We didn't yet understand how quickly it would spread or how completely it would change healthcare around the world. Hospitals shifted to emergency response mode almost overnight, and I made the decision to become a travel nurse. I was felt to answer the call to help wherever the need was, and my family could have really used the money at the time. My first assignment brought me to Cincinnati, Ohio. I was to work at the University of Cincinnati in the CVICU. My assignment was to be 4 weeks, but they cut it way short and sent me to Boston, Massachusetts because I guess the influx of patients they were having there warranted for us to be transferred. We all were a little bit nervous and a little bit apprehensive because what it felt like was that you were being deployed. They literally had a booth with 2 representatives from the company catching us as we came in from our shift from the day, letting us know that we needed to pack our bags because we were canceled from Cincinnati and we're leaving on a flight the next morning to Boston. It was April 5th now, 2020. I was missing my middle daughter's birthday. It was sad, and I was on my way to Boston on a flight that had a total of 5 of us on it, 3 rows apart doing the social distancing, and nobody was talking to anyone. Even the flight attendants weren't talking to us. The airport was basically abandoned. Only 2 shops for food were open, and of course, one of them being Starbucks. They had an emergency relief staffing agency call everybody and offer $10,000 a week to go to New York. This was the height of the first wave, guys. New York was being hit so hard. If you remember, there were so many dead bodies. They had to have coolers outside of the hospital to wait until the morgue could take them. Once we got to the hospital in Boston, we were all separated into different units. My unit in particular was a post-anesthesia recovery unit that got turned into a COVID unit. It had, I'll never forget, guys, it had negative airflow HEPA filters with tubing going up and out the windows. With the windows, I think it was like a cardboard or a hard plastic substance taped around so that none of the air would be mixing. Everything was supposed to be negative airflow. This was a 10-bed PACU unit with 10 beds separated by curtains. Everybody in it had COVID. Everybody in it was on a mechanical ventilator. Once we put our PPE on, the personal protective equipment, the goggles, the gowns, the gloves, the booties, the bonnets, nothing came off, and we sat in that unit all shift caring for our patients. We all had 2 10-minute breaks and 1 30-minute lunch. We were relieved by each other in the COVID room and had an ante room or like a separate lunch room that we could eat our snacks and a separate bathroom that we had to use. The physicians rounded once each morning. That was your opportunity to ask questions and receive new orders. If you didn't catch them then, chances were slim to none you'd get to talk to them for the rest of the day. Pharmacy delivered medications every 4 hours through what they called the ante room, which is a buffer room space where supplies and medications could be exchanged without direct contact. Looking back, it reminds me a little bit of today's no-contact delivery services, except for the stakes couldn't have been any higher. What I remember the most wasn't about the physicians and the pharmacy. What it was walking into a room filled with ventilators. I had had ventilator patients in the past, so this wasn't new to me, but the sheer amount and the sickness that these people had was next to nothing I had seen before. I have never forgotten that feeling. There was a strange silence, yet at the same time, there was never silence. Ventilators constantly alarming, cardiac monitors alarming, IV pumps beeping, oxygen alarms sounding, the soundtrack of an ICU filled with patients fighting for their lives. Every shift brought new rumors, new research, and new hope. We always watched for the latest FDA emergency authorization, wondering if the next treatment would finally make a difference. I also want to give a shout out to the Boston nurses right now because it took me about 2 weeks to understand that the nurses weren't just yelling at each other and yelling at their patients. That's just the way they talk. It also took me a while to figure out what a Johnny was. Guys, they call the patient gowns Johnnies. And it took me forever to understand that when they were asking me to hand them a Johnny, that's actually what they were talking about. So I had missed my middle daughter's birthday, Easter, and Mother's Day while on this assignment. It all ended up being worth it because I was able to help pay to get my family back to California from North Carolina, where we had family from both of our sides still living there. Just as we started to think the pandemic was coming to an end, restaurants and stores were starting to reopen and life was starting to look bright again, little did I know that the second wave, the Omicron wave, was going to hit its hardest right here in California. Stay alert for the next episode, guys, because this is when the camera comes out and my mind is literally blown on my next 2 assignments.
Emma's laughing at the ducks in a row. Molly's chasing chickens through the muddy grove.